Welcome to Cardiovisual. My name is Tom Blevins with Texas Diabetes and Endocrinology in Austin, Texas. Today, we'll be talking about SGLT2s and the increasing need for endocrinologists and cardiologists to work together in managing our patients with diabetes.
Of course, cardiologists and endocrinologists alike, we know that cardiovascular disease is the leading cause of morbidity and mortality in our patients with diabetes. Primary care physicians, our endocrinologist colleagues have historically spent much of their time managing cardiovascular risk factors in patients with diabetes, things like lowering blood pressure, lowering cholesterol. But until very recently, we haven't had hard evidence about what glucose lowering does to cardiovascular health. And I think that's where sort of our stories start to get closer and closer. But why would or why should cardiologists, maybe even more so than in the past, care to know about diabetes management?
I used to see diabetes patients in the cath lab maybe once every 2 weeks, maybe once a month. I see 80% every day of diabetes. Now, diabetes wasn't a real popular topic, especially when we're talking about insulin, because most of us don't give shots, and most of us are actually more related to that. I think the glucose is one thing that's kind of certainly important, and I would point that out right off, because if Dr. DeFranzo was here, he'd sure want me to mention that. I think that there's cardiovascular endpoints, but if you don't control the glucose, you're going to lose your kidneys and your eyes. And those are big things for most people. So I think cardiologists now, the reason that we're involved in it is because, one, we don't have enough endocrinologists, for one. There's no way you guys have enough people around. However, we don't have any diabetic nurse educators. Okay, so it's a catch-22. We learn from each other. I would say that every day, including today, when I saw cases, I had no patients without diabetes today, not one. So they're going to have to learn this, and I think the better control. We didn't know lipids until the endocrinologist brought me statins. It took 10 to 15 years after you guys used them before cardiologists became even interested in them. So that's why I think diabetes now has become front and center and important to our society.